Africa bears, as has been said here earlier, 25% of the global disease burden, despite accounting for less than 20% of the world's population. Yet, our continent still produces less than 6% of its medical supplies, only about 1/3 of its pharmaceutical needs, and a mere 1% of the vaccines it consumes. And this was starkly reminded to us during the time of COVID. This is more than a health gap. It is a structural vulnerability. Africa's pharmaceutical expenditure stands at approximately $25 per capita, compared to a global average of more than $160. That disparity reflects not only constrained access, but also underdeveloped markets and limited industrial capacity. Across the continent, nearly 700 pharmaceutical manufacturers exist, including in Kenya. Yet most remain small and mid-size, fragmented and concentrated in only a handful of countries. This limits scale, limits competitiveness, resilience, and our ability to respond effectively to present and future crises. We also continue to face persistent structural barriers, fragmented regulatory system, as has been said here, limited market integration, and that is why we have our good friend, the Secretary General of SCFTA, to see how we can consolidate, integrate our market. And of course, insufficient demand certainty, all of which deter large-scale private investment. The COVID-19 pandemic exposed these weaknesses with devastating clarity. Africa was last in the line, as we all know. We must never allow that to happen again. No single country can solve this challenge alone. To overcome fragmentation and achieve scale, we must act as one continent. This requires the full implementation of the Africa Continental Free Trade Area to unlock the market of 1.5 billion people, the accelerated operationalization of Africa Medicines Agency to strengthen regulatory harmonization and trust, and a coordinated investment strategy capable of creating predictable and bankable markets. In Addis, we build consensus around regulation, trade, skills, and investment. At the World Bank Spring meeting, AIM 2030 was introduced to the global community, with early investments such as BioVac in South Africa demonstrating what is possible around this space. Now here in Nairobi, we move decisively from ambition to execution, from commitments to bankable projects, and from dialogue to delivery. To African governments like Kenya's, let us fully implement our commitments on regulatory harmonization, market integration, and industrial policy so that we can unlock Africa's manufacturing potential. To develop markets, to develop development partners and implementing institutions, let us move with urgency to structure and finance scalable, bankable projects capable of delivering results at speed and at scale. To the private sector, Africa presents a market of nearly 1.5 billion people and a rapidly growing demand for health products. This is your moment to invest, to scale up production, and to anchor long-term partnership with us in this continent. Excellencies, Africa has the science, Africa has the workforce, Africa has the market, and Africa has the will. Through AIM 2030, we will transform these assets into a resilient and self-sustaining health ecosystem build in Africa, for Africa and for the globe. I wish you very fruitful deliberations. Thank you very much. Africa's pharmaceutical market stood at approximately $30 billion in 2024. By 2030, it is projected to expand to $50 billion. This is not only a health imperative, it is one of the most compelling industrial opportunities of our time. If there are any people seeking opportunities for industrialization, for investment, this presents a real and present opportunity. The Africa Initiative for Medical Access and Manufacturing is our collective response. AIM 2030 is not a declaration. It is a delivery platform. It is designed to expand equitable access to quality medical products, strengthen health systems resilience, and drive industrialization through manufacturing, innovation, and ultimately to create jobs. It aligns directly with the Africa Union's Agenda 2063 and with our shared ambition to produce at least 60% of Africa's health products locally by 2040. Kenya, I must say, is ready to play its part. Our country is strategically positioned as the gateway to the East African fast-growing economic bloc, supported by a strong and expanding domestic market, world-class logistics anchored by the Port of Mombasa, and of course the standard gauge railway, which we are now extending all the way to Kampala and to Kasese at the border with DRC, and of course our very skilled Kenyan workforce and a stable and friendly business environment. We are taking deliberate steps to strengthen our pharmaceutical ecosystem. This includes enhancing the capacity of our national regulatory authority to achieve World Health Organization maturity level number 3, thereby ensuring global confidence in the quality, safety, and efficacy of Kenyan manufactured products. Our ambition is clear: to position Kenya as a regional hub for pharmaceutical manufacturing, health innovation, and medical supply chains. And this journey is already underway. In Addis,
pharmaceutical production is not only marketing, it's not only for marketing, but it's a basic pillar for human rights, because the index of human development is based on this factor of health, which is very important for human health. We have developed a program through the FSTA, which is the African Free Trade Area, and we have the Director General of Africa, CDC. Today, the issue of health funding are very important, and this is because the sources of funding are becoming rare. Therefore, the capacity of the continent in terms of pharmaceutical production, as well as the circulation of products and in African markets, therefore you need to create the value chain.
We have launched the World Bank Group, what we call AIM 2030, which aims at doubling pharmaceutical manufacturing in Africa by 2030. The foundations are here already in Kenya, and a lot of countries have already signed the compact. I think we're getting close to 15 countries who are signing the compact. What we know is that we should not wait for crisis to build resilient systems. When it happens, it's too late. We have learned it from COVID, we learned it from avian flu, we learned it from all these crises. To have today 3 messages. And I would like, Mr. President, to pay tribute to 2 of my former colleagues and friends, is Soji, where is Soji here? Soji was, Mr. President, he was a manager in Africa, and he's the one who came to my office and said, Mr. Makta, we need a CDC for Africa. At that time, a lot of people say, no, CDC is for large countries. Africa doesn't need a CDC. He said, we worked together, prepared a 200 million project, we went to the board, and at that time, Mr. President, a lot of people didn't believe in it. That was the foundation of CDC Africa. And we see what he has done today. Secondly, I would like also to pay tribute to another brother here, Mr. Amadou Sall, who has created in Senegal one of the best research facility, 150 African researchers, all of them are African, working on mRNA and other type of vaccine. Kenya has also the same human capital. So I give these two examples, Mr. President, to say that this story can be made when we are organizing ourselves and we are supporting each other in the continent. And under your leadership, Mr. President, I have no doubt that things will go to the next level. First action, we need, as we create the CDC Africa a few years ago, to create a strong, to reinforce CDC Africa, and to create a strong African drug agency. Without it, no manufacturing can grow in the continent. Secondly, invest in our human capital. The University of Nairobi is a great university that can be a magnet for excellence in the country. The World Bank Group has few instruments for that. The World Bank Group can support in financing the African drug agency, the same way we did with the CDC. The World Bank Group can help with the Africa Center of Excellence to support Kenya in building the ecosystem. I will stop here, Mr. President. I want to say thank you for your leadership, and once again, thank you for these excellent events that you have organized in Kenya, which hosting the leadership of the continent and France. Thank you.
We meet today at a defining moment for Africa's future. Just this month, the emergency of hantavirus reminded us once again that health threats do not wait. They do not wait, they do not respect borders, and they expose instantly the strength or fragility of our system. But this time, Africa is not standing still. Africa is moving forward, boldly and decisively. Through the African Forward Agenda, we are rewriting the narratives from dependency to determination, from vulnerability to resilience, from promise to performance. At the center of this transformation is AIM 2030, the African Initiative for Medical Access and Manufacturing, because the reality is undeniable. Africa covers over 25% of the global disease burden, yet still imports most of the medicines, vaccines, and diagnostics. COVID-19 was a wake-up call. Hantavirus is another warning. But more importantly, they are a catalyst. AIM 2030 is our response, a bold, committed to produce what we need it for our people. A vision to double local manufacturing, to secure equitable access, and to build resilient systems aligned with Agenda 2063. The African Medicine Agency, and the African Continental Free Trade Area. But let us be clear, vision is not enough. Delivery is everything. From WHO perspective, 4 priority areas will determine access. First is trust. Strong regulatory systems are the foundations. Quality is non-negotiable. Without trust, there is no market. And without a fully operational African Medicines Agency, we cannot move at scale.